You should actually come and have your ears checked around the age of 50 for the first time and have a baseline hearing test. This way we have data so that we can compare to as you mature. Typically, people do not think they have a hearing loss because it is happening gradually. They're unaware as to what extent they're missing out. And it's usually their spouse or their family members who notice first. They may say something. If it gets to the point where your friends are telling you, it's probably pretty significant. Definitely the sound quality has improved. The hearing aids are very natural sounding. So even when someone comes in with a fairly significant hearing loss, I usually put hearing aids on their ears after I test their hearing and let them listen to me explain their hearing test while they have the hearing aids in. And they can't believe how clear I sound and how normal I sound. And it's not until I take the hearing aids off their ear and they now realize what their hearing loss sounds like that they have that aha moment. Oh, okay, that's how I've been hearing. You sound like you have a pillow over your mouth. So the thing about hearing loss is generally most people can have normal hearing in the low frequencies and hearing loss in the high frequencies. So they hear most things easily at a normal volume level, but it's the clarity that they're missing. They're missing the sounds when someone is speaking, and if you think about S's and TH's and T's, how often are they in the English language? So their brain is trying to fill in the gaps with things that seem to make sense when they're having a conversation, but then they misunderstand what they're saying because they mishear the word and their brain inserts a word that's not correct. Bluetooth technology is a wireless way to connect to other devices. So hearing aids in the past needed an intermediary device, whether it be a neck loop or a clip that you wear, so an additional item to charge in order to achieve this connectivity. Now hearing aids can connect directly, so your phone rings, you answer it like you normally do, the sound comes right in your ears, and you can have that conversation with people. You hang up like you normally hang up. If you are a little bit more tech savvy and you like to listen to music, you play music on your phone, it comes in your ears. So you can put your phone in your pocket and listen to your music. Or you can download audiobooks and listen to an audiobook through your hearing aids. And they connect to TV, Bluetooth, without an intermediary device as well. So when you come in for an eye exam, they do a quick hearing screening, and if they find that you have a hearing deficit, then you come to see me and I'll do a more comprehensive hearing evaluation. If during that evaluation I find that you do indeed have a hearing loss, then I will program a set of hearing aids for you at that time and put them on your ears so you can hear the difference for yourself between how you're hearing and how you should be hearing. Sometimes I even have my patients take home a trial set of hearing aids for a week or two to help them to see what it's like in their own hearing environments, at home with family and friends, out at restaurants, to help them to make the decision that works best for them. Restoring hearing loss can be a game changer. For people who have more significant hearing losses, I've put hearing aids on them and they've actually been brought to tears in the chair because they didn't realize to what extent they were missing out on speech and clarity. Their family relationships are so much easier when they can hear. People don't realize that when they have a hearing loss and they're having a conversation with someone, they're sitting forward and they're all tense. When they can hear clearly, they sit back, they relax, they enjoy the conversation. They have a much easier time following the events. And most events that happen within the family dynamics, they're on the spot. So if you miss it, it's gone. So it's best if you hear it the first time.